Continuing in our heart health coverage, some local first responders are teaming up to learn better ways to treat patients experiencing cardiac arrest in the field. Mayo Clinic ambulance workers and Rochester firefighters have been training for the past month to streamline a process that's normally done in the hospital. ABC 6 News reporter Alex Cotter was at the training session today. He joins us now live with details on how this new process actually works. Alex?
Laura, when emergency crews arrive on a scene to assist a patient who is experiencing cardiac arrest, they start giving CPR and use an AED, but sometimes patients don't respond to the shock from an AED. So that's why Mayo Clinic is leading an effort to help restore a patient's heart rhythm using a little bit different process.
Okay, we've got VFib on monitor still.
7 minutes ago? Okay.
Okay, everybody clear, everybody clear. Shock delivered.
So once we arrive on scene, they've had multiple shocks. We know that keys us into that this patient might most benefit from ECMO.
Extracorporeal membrane oxygenation, or ECMO, is a machine that takes over the function of a patient's lung and heart.
The machine is just a bypass machine. What it does is it takes the work of the heart and lungs out.
When first responders first come into contact with a patient experiencing cardiac arrest, using this new training, they'll be able to assess the patient to see if they would qualify for ECMO. If they do, and they're within 30 minutes of the hospital, it can speed up the life-saving process once they get there.
And that will give us the insight to alert the ED that we're coming and expedite our transport there.
This assessment is normally done at the hospital, but a recent study from the University of Minnesota shows that if a patient has early access to ECMO and chest compressions, or for short, eCPR, they are 6 times more likely to survive. That's why Mayo Clinic has decided to start assessing patients in the field.
A patient who suffers a cardiac arrest in really any situation, out in public, at a sporting event, or in their own home or anywhere else, could potentially benefit from.
Dr. Aaron Clausen is a Mayo Clinic physician. He says only about 8 people a year will qualify for this, but he says every life is important to save.
The vast majority of people in cardiac arrest outside of the hospital will not survive. And this program gives a few of them a much better chance of survival.
Now, there are a few other places in the country that use a program similar to this, and experts say they've been pretty successful. Now, first responders are now wrapping up that training process, and the new program will be implemented here at the end of the week. Laura?